Okay, here we are. I hope everybody had a great day. We are on another topic that was brought up in the clinic. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going over foot pain exercises when you have arthritis. So obviously there's a caveat, generally there always is a caveat to all of my videos. If you are over the age of 18 and you go get an x-ray at the doctor's office, you are going to have arthritis, okay? So don't always be so quick to accept a diagnosis of arthritis, because if you are over 18, it doesn't matter what body part, there's going to be some wearing away of the joint. Sometimes even if you're under 18. But it is very quick to, people are very quick to just say, oh, it's arthritis in my knees, or it's arthritis in my toes, or arthritis in this, and write it off saying nothing can be done. When in reality, a lot of things can be done, and it's not a lot of the arthritis that's causing your pain. I'm not saying there's not arthritis in the joint, but a lot of times that doesn't necessarily link to the reason you're having the pain. So always be careful when you're gonna write it off with arthritis. I see, I hear a lot of people writing off back pain and things like that. Oh, my spine is arthritic. Yeah, so is mine. I don't have back pain. So there's a fine line between what we can really attribute to arthritis and what we can actually attribute to other things. So just be aware. What happens with arthritis generally is it's going to be painful all the time. So if you're experiencing pain, intermittent pain, pain that you can get relief from, that's generally not arthritis. Arthritis doesn't have a relief button, so there's not a whole lot of things you can do to relieve arthritis pain. You're generally going to have some sort of dull ache in there at all times. Arthritis doesn't change throughout the day, so you're going to, just be aware of some of those symptoms when you're talking about arthritis. So now let's talk about foot exercises for arthritis. A lot of times if you spend a lot of time running on your feet, for your job, you're going to develop some sort of foot pain. Foot arthritis may be a common thing that you get diagnosed with. So let's go over some things that you want to do. And with any joint, whether it's arthritic, not arthritic, you want to balance your stretching and you want to balance your strengthening. It's important to do both. It's not just a pain relief exercise that you want to do. You want to do some things to strengthen it also. With arthritis or anything, honestly, moving generally will help it feel better. So when you're talking about foot pain, and this is arthritic, non-arthritic, whatever, when you're talking about foot pain and you have foot pain, you want to make sure you're in good supportive shoes all the time. So you may have to kind of forgo the flip-flops in the summer, you may forgo the bare feet, you may forgo the flats, you may have to just wear sneakers. So that way you have that support at all times. If you feel that you, every time you walk you're getting a lot of pain, putting yourself in flats or in bare feet or in flip-flops will increase the amount of stress on that joint, and that's not something you want to do. You want to make sure that you're giving it every bit of cushion that you can, every bit of support that you can, and shoes, and a very good pair of shoes and a proper pair of fitting shoes will help you do that. So that's kind of number one. You want to make sure that you're really making sure that you have that good supportive footwear at all times. When it comes to heat or ice, that's the debate. A lot of people who have arthritis say heat makes it feel better, it feels good, but you really do want to ice. If you have that pain, especially at the end of the day. Now, if you're going to do some sort of exercise and you want to put a little heat on it, great. But if you're like at the end of the day, you're done, you're sitting down, put some ice on it. Help some of that swelling, help some of that inflammation calm down. What also you want to be careful of with any foot pain is how you compensate. And we talk about compensation a lot in a lot of our other videos. We have them on our YouTube channel. Just go to Total Performance Physical Therapy and you'll see a ton of videos. And we always talk about compensation, whether it's with the knee, with the hip. And when compensation comes in, and compensation just means you're starting to limp, you're starting to use your foot differently. And maybe it's not something that you notice, maybe it's not something that you see, but if your foot's in pain, your body's going to do everything it can to not make it in pain. So you're probably not pushing off your toe as much. You're probably not putting as much weight on the foot. You're probably not going through the full weight bearing of your foot, just to avoid some parts of the foot. Or as you walk, maybe you're walking more on the outside of your foot, or maybe you're walking more on the inside of your foot. All of that's going to have direct effect not only on your foot, but on your knee, on your hip, on your back. So a little toe problem or a little foot pain that you want to write off can actually lead to a significant cause of pain in the ankle, in the knee, in the hip. hip. So don't just write it off and say it's just foot, it's just arthritis. You want to be aware that there are certain things that can actually crop up if you ignore it long enough. So let's go through some exercises that you can do. So like I said, with arthritis, with anything, you want to balance the stretching and the strengthening. So I'm going to show you 2 stretches that you want to do, and then we're going to go through kind of 2 strengthening exercises that you want to do. So the first stretch you're going to want to do is you're going to want to just take your shoe off and you want to stretch the bottom of your foot. All right, so my toes are flat on the ground and my heel is just coming up. If this causes you pain, you don't want to do this. You can do this sitting down, you can do this standing up. That's why I like this stretch. It's pretty portable. You want to do about 6 of these 30-second holds. All right, you want to make sure that you're putting pressure on not only the big toe, but all other 5 toes. Then, for the second stretch, all you're going to do is just flip your toes the other way. All right, and you're going to just stretch. This one, you're going to feel a stretch on the top of your foot. All right, so you can bend the other knee if you need to get a little bit deeper stretch, but you should feel a stretch through the front of your toes, through the front of your foot. Now, again, if that hurts, don't do it, all right? Or back off the stretch a little bit. It should feel good. You can do this sitting at your desk, standing wherever you feel comfortable. Those are 2 stretches that you can do throughout the day, all right? So it's not, if you don't hold them 30 seconds or anything like that, you can start to loosen up those muscles by doing those throughout the day. You may even get some relief just by doing those a couple times a day, but as many times as you can. So now we're going to talk about strengthening. Now, so the first strengthening exercise we're going to do is just toe. So you're going to take a towel, you're going to lay it flat, and you're just going to grab it with your toes and try and scrunch it forward. Now I'm doing this on carpet, which is not the best. You might want to do this on like a tile floor or a hardwood floor or some type of linoleum, so you're able to actually grab the towel and move it towards you. But you want to grab it with all of your toes, all right? And you want to just grab it and move it towards you. Just a couple times. Again, it's going to get those really small foot muscles involved and strengthened. And a lot of times what happens is as we run or as we walk, we kind of curl our toes and grip the surface. So if you go to balance real quick and you notice you're like gripping the floor with your foot, chances are your muscles that are inside your foot, your intrinsics, are a little off balance also. So you want to really strengthen them. When you go to balance on one foot, you should not feel any pressure in your toes. You should be able to balance and actually kind of lift your toes up. The next strengthening exercise you want to do is just a foot tap. And everyone's like, oh my gosh, this is so stupid. And I get it. Foot tap for a minute. It's going to start to burn. Most people can't do it for a minute. And then if you want to do it 3 times, you're really going to feel it. Like it's going to actually be very difficult at the end. You're going to have to really tell yourself to lift your foot up and lift it up off the ground. It's going to get difficult by 3 minutes. But again, it's going to strengthen all of those muscles that are around the foot. Really important to do. The stretching and the strengthening balance are going to help with that foot. And it's really important that you keep that foot both stretched out and both strengthened. It's important that you have that balance. If you are experiencing foot pain and want a free consultation with one of our doctors of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.